On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Daniel Aldrich, Dr. Richard Ha, Dr. Lowell Ku, Dr. Bob Peters, Hi again, everyone. I'm Candace Kruger along with Jim Knopf. We're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center is one of the top medical centers in all of the Dallas and Frisco area.
And out of this top medical center, of course, some of the best doctors in the entire Dallas and Frisco area operate right here, like pediatric plastic surgeon Dr. Matthew Trovato, who helped one little girl who was born with an ear deformity.
When she was born, we noticed that one of her ears was flat. The curve wasn't formed correctly. And our pediatrician noticed it also and referred us to Dr. Travato's office.
About 20 to 30% of all infants are born with an ear deformity. Over the first week of life, that deformity resolves on its own in most cases. But in about a third of that 20%, the deformity doesn't resolve. And that deformity, once the cartilage firms and hardens, is there with that child for the rest of their life. What we aim to do is try to help parents and physicians identify those children with deformities and decide whether or not we can intervene early in order to correct that deformity non-surgically rather than waiting until that child is 7 or 8 years old.
Being that she came in so young, they knew that the ear wells would work for Emma. They were very soft. They didn't bother her at all, and they were interchangeable. When they would fall off, we could put another one on. She wore them for about 9 weeks, and I think they worked great. Much easier than having to do surgery at a later date.
By intervening early, we use a system, a device that molds the ear cartilage, shapes the ear cartilage while it's still soft, and then once it hardens in that first 3 to 4 weeks of life, we remove that splint on the ear, and the ear is then perfect. Emma came in basically the same way that most of the infants do. Mom recognized that there was a crimping to the child's rim. What we did was we applied the ear well and molded Emma's ear and corrected that rim deformity. We were able to get her into the office in about the first 2 weeks of life, and so that enabled us to intervene.
Emma's doing great today. She's a very happy baby. Her ears are perfect, and we are so happy that we came to Dr. Trovato. Our overall experience was amazing.
Brady has a question for Dr. Charles Toulson. How do I know when I need a joint replacement?
Arthritis pain often presents with activity. In the late stages, patients can have pain at rest or pain that wakes them up from their sleep. When patients have reached this point and anti-inflammatories like Tylenol or Aleve are no longer effective, when patients failed physical therapy and other conservative means, they're great candidates for both total hip or total knee replacement.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Trigeminial neuralgia is a disorder where patients have lancinating pain in their face, typically in one of three distributions, either supraorbital, infraorbital to the nasal region or nose region, or below the mouth to the chin region.
I went to the neurologist for about 3 months, and I wouldn't go the route of, because I am a single mom and ran my own business, so I couldn't be in the drug-induced coma. And I was asking really for a fix. I was like, I don't want to Band-Aid the problem anymore. I want this fixed.
Laura's case, she had trigeminial neuralgia for almost 17 years, and it initially manifested itself in her early 20s, and she underwent the medication route for multiple years and became ineffective to the medications and intolerant to them.
Well, at first, I thought it was just a toothache. It felt kind of like having your teeth drilled without Novocaine. And then it moved into the whole side of my face.
Basically, neuralgia is nerve pain. And if you think that patient has nerve pain, you treat it typically with seizure medications.
The actual nerve is about the size of a wire to your headphones to your iPod. What he did is cushioned the trigeminal nerve and then put me all back together again. And now my typical day is I go to work, I have a full day of work because I have my energy back. I get to come home and I go to dinner with my kids and we watch a movie and we're up till 10 o'clock at night after homework and everything, and it's a real day back again.
Laura had a good result from the surgery. We weaned her off the majority of her medications by 3 months post-operatively. She had some incisional numbness around her incision site, but she's much more functional, much more happier than she was preoperatively.
The pain is gone, and it's gone for good. He recognized that it was something that needed to be taken care of right away and didn't make me go through a bunch of red tape, and just took care of it.
Today at Forest Park, we are testing our disaster plan. We're going to look at what kind of patients are going to be coming to the hospital and how we would handle those in a disaster situation. Every good company and every great hospital is going to have a plan of what they should do in case of an emergency, in case of a disaster. We have that in place. Now we need to know if it would work in the real situation.
Even though we're a small surgical facility, we are still an active part of our community around us. And in the event of something happening locally, we would like to be able to respond and participate. And there's always going to be people that will come in, and we want to be able to handle that. And you can never assess how you will handle an emergency situation until you actively try to go through it.
We had a lot of people today participating that were not part of Forest Park. We had our security program here, Fort Knox Protection. They swept through the hospital today to make sure that all the doors were locked and that the hospital is secure. We don't want anybody who might be exposed to chemical agents just walking into the hospital. We also had the participation of Brookhaven College nursing students. They played the role of our patients today. Sacred Cross EMS came and participated. They brought patients to our triage area so that we would know what it'd be like in case we did get ambulance to our hospital. Usually ambulances don't come to Forest Park, so that was something that we really needed to test today.
I think it went very well. I think it was a very good plan. People always, are confused when they're faced with a new situation, but we got it sorted out and we kind of got our flow going, and we've figured out our problem areas and what we need to correct and, tinker with so that we can work even more smoothly in the event of a real disaster.
Today at our drill, we had everybody here from lab to pharmacy, all the nursing staff, registration, just every department of the hospital you can think of. Somebody was here representing that area and making sure that their clinical area was ready for a disaster. And I really appreciate everybody that came out to participate with us. You never know when a disaster might happen, and everybody has to be ready. So I just want to really thank everybody at Forest Park for coming out and participating in our drill and making it a success.
Did you know that Forest Park Medical Center Dallas has the AccuVein Vein Finder? This allows the phlebotomist to actually see the vein before drawing your blood, eliminating multiple sticks.
when Forest Park first opened, they had the Da Vinci robot and have been utilizing it since they opened. It has transformed the way that we've been practicing surgery. Instead of having patients be in the hospital for 2, 3, 4 days after a major surgery, it has allowed us to be able to have the patients come in and after major surgery be able to go home the same day, possibly even going home the next day for sure. It's allowed us to be able to take large, benign growths out of patients in gynecology under general anesthesia and be able to remove them through minimal incisions less than 1 inch across. So this is the operative console for the Da Vinci robot. This is the viewfinder. I place my head in like this when I'm looking, and these are the two TV screens that I can see the active picture inside the patient as I'm operating. It's a 3D high-definition screens, so I'm able to see exactly what's going on without having to wear the dorky glasses that you do when you see a 3D movie at the movie theater. My controls for my hands are down here, and I put my fingers in them, and I'm able to move the levers like this, operating the instruments inside the patient's body by opening and shutting them, moving them side to side, and using my wrist to move the instruments inside the patient like this. Then you'll notice down here I have different foot pedals, and that allows me to operate the camera and the different angles from the camera, and then allows me to operate the different instruments, switching from one arm to the other and back from burning and cutting and all the different options that I have on all the different instruments. I can see better using the robot than I could if we had a big, huge open incision. The camera is a 3D high-definition screen that I'm looking through. So I'm seeing more than I can see if I had an open incision. We're trying to make as small incisions as possible on our surgeries because it lends to less complications and quicker recovery. And Forest Park is committed to being at the very cusp of the advancement of medicine and advancement of surgery. And they're committed to doing that with whatever technology is available.
Up next, you'll meet a little boy named Kemper who unfortunately was born deaf. But thanks to our next best doctor, otologist Dr. Bob Peters, he was able to give him the gift of hearing.
After Kemper was born, he had a newborn hearing test at the hospital. So we were taken to several other doctors to find out more about his hearing and hearing loss. We'd heard about getting cochlear implants and had done some research on them, and that's kind of the road we decided that we wanted to take.
A cochlear implant is truly a bionic ear. It is the only available full replacement for a human special sensory function.
When he was born, we found out in the hospital before we even left. You know, it kind of took the joy and excitement out of having a baby. You know, all of a sudden told that there may be a potential problem with your son. Because, you know, nobody wants to find out that something is, you know, wrong with their child, especially our first child.
It's a day surgery type procedure typically. Maybe small children and babies would spend the night. But this surgery takes no more than about 1.5 hours to 2 hours to do. That portion is allowed to heal, and then a very specialized computer is used on the outside called the processor. And that processor takes all the sound in the environment, digitizes it, and sends it to the implant via an FM signal.
And when they first turned him on, he'd never ever heard sound. So they started him off very quietly and slow, so not to scare him, you know, because it's a whole new world to him.
In the second that we had our first appointment with Dr. Peters, he said, okay, you know, my staff will take care of everything, and they did.
In the case of Kemper, who was identified early and whose parents wanted to be very proactive, very aggressive in doing everything they could for him, they presented early on so that by the time I saw them and that we had completed all of the evaluations at 9 months, not only was he ready for an implant, but I felt he was old enough and he had grown enough that we could do both ears at the same time.
It really has changed his life. He turned into a different baby. He was just a lot happier, and it's just like his whole world kind of opened up.
But yeah, we think very highly of Dr. Peters.
Before I had a chance to get with Dr. Hung, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely it just no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, and she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
We talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had my nose fixed, if you will, and so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinus to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
Now, for the latest on Forest Park Medical Center, as well as all the great physicians that operate right here out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on the Forest Park Medical Center tab.
And now we're going to head on over to our next best doctor. It's orthopedic surgeon Dr. Dan Aldrich, who helped one patient with a torn rotator cuff.
I was having a lot of trouble with my arms. Especially my right arm. I could not lift up anything with my right arm. If I went to the refrigerator and grabbed a gallon of milk, it ended up on the floor. I mean, I literally could not lift anything up, even a Coke bottle out of the refrigerator. It wasn't my strength in my hands that was affected, it was lifting things.
Classic symptoms of a rotator cuff tear would include weakness when lifting away from the body. So any type of lifting overhead or to the side particularly is very painful and weak. In other words, they lose the strength to even hold something out here. It just drops.
I've been dealing with it for probably 2 or 3 years. Didn't think anything, you know, I thought, okay, I'll rest it for a while, it'll be okay. I'd wait a month or two, and it got so bad I was taking my hand and lifting it up to put it on the steering wheel to be able to drive.
The great news about rotator cuff repair is that we've come a tremendous way as far as making the whole experience much easier on the patient. We can repair even large rotator cuff tears through a scope, but we're not making any open incisions in any of these cases. They're all done through very tiny, 1/4 of an inch incisions. In a rotator cuff, it's not just inflamed, but it is ripped away, and the muscle that is attached to it pulls it away. So in a large tear, you could have a gap this big, where you need to get that tendon back in place. So that's where this anchor comes in, because it's very solid, it holds in the bone, and then these stitches, as you tie it, it'll pull it right back down and sit it right back down where it belongs.
Since having it repaired, I'm back to new. I have no side effects, nothing slows me down, and I've started fishing again. I've played golf twice since I've had it. Now, it hasn't improved my golf game any, but I'm right back where I was, you know. No ill effects from any of it. Really surprising. I expected to have some type of, you know, restraints on it or whatnot, but nothing. Nothing slows me down anymore.
We started trying to get pregnant probably in May 2008.
Right.
And so it took us, we tried for about a year before we went and saw Dr. Ku, and then my OB recommended that we go see him.
Amy Baker and her husband unfortunately struggled with infertility for some time. Fortunately, they came and saw me at the office. We did a workup and found out that it was possible that she could still conceive.
Well, there were various tests that I had to go through in order to determine what was the issue. Both of us had to go through certain tests in order to determine what the issue was, and it turned out I had what's called PCOS, and so I wasn't ovulating regularly.
Amy and her husband initially began with some basic treatments for infertility, including insemination. We tried a few rounds of insemination without success, and so we moved quickly to in vitro fertilization. In vitro fertilization occurs where the patient takes medication to grow eggs on her ovaries, and then I go in and I harvest the eggs. We mix the eggs with the husband's sperm, and the embryos are formed. They're incubated for 3 to 5 days, and after 5 days, we grade them, and the best embryos are placed into the uterus.
Throughout the process, you get a little bit impatient and obviously just want it to happen as quickly as possible, but Dr. Ku makes sure that everything is perfect before moving forward so that you can have a successful procedure.
With Amy, we did transfer 2 embryos. They both looked healthy, but we weren't sure which one was going to make it. Unfortunately, they both made it, so we're very happy for them.
And he was so kind and sensitive because obviously he knows it's a very upsetting time for a family who wants to have kids and is having trouble. And so he's very calming and very helpful in just explaining things to you and being very honest at the same time.
The chance for twins with in vitro can range between 33% up to 45%. We're always shooting for success with each try, with the first try especially, so we're very excited that Amy had success with her first try.
The girls are wonderful. They're obviously a lot of fun. Obviously, we're very thankful for everything he's done for us.
Sometimes when people lose a lot of weight, there's an excess of skin. Well, there's one doctor that operates right here out of Forest Park Medical Center that can help you out. Plastic surgeon, Dr. Richard Haw.
I weighed 485 pounds. I've lost a little over 300 pounds in a period of a little over 4 years. I did it without surgery. I just woke up one morning and decided I was tired of being the fat guy and decided I needed to make a change, and from that moment on, I changed it.
When we talk about massive weight loss, this is different than somebody who is on a post-pregnancy diet or lose some of that college weight. That's not the patient population I'm talking about. I'm talking about patients who have had massive weight loss. And these patients tend to do this in a very rapid way. This can be as a result of surgery. Likewise, some patients, some people can do that without needing surgery. The result on their skin and their body shape is oftentimes very similar. What happens is your body's metabolism and physiology is different. It changes. You have a deflationary effect. So whatever skin that you used to have in fat, just imagine the fat going away and the skin being left behind.
Dr. Haw is actually an acquaintance. His wife kind of grew up with my wife, and I had, as I was losing weight, had planned when I got to my goal that eventually I would meet up with him and get him to do the plastic surgery to take care of the extra skin from the weight loss.
With Mr. Winters, I was able to sit down with him and we came up with a very tailored, specific plan for him. His primary concern was around his trunk, his arms, and his breast. But we addressed all those areas through a comprehensive body lift, and his results are outstanding.
One of my favorite things to do is I road bike, and as I would bend over, you'd feel, especially in the abdominal area, you'd feel that skin as I was bent over biking. Now it's just a natural curve and feels normal. Dr. Haw is professional from the get-go. He's going to let you know what you're up against, how it's going to work, and the way it's going to all pan out. Everything that he told me in the very beginning is exactly how it went.
I am the director of critical care, so I have a couple of different departments that handle all of our really critically ill patients here at the hospital. And when I came to Forest Park, we were just starting. It was brand new. And so I got to get in on the ground level. I got to participate in developing our new policies, our processes, and it was really rewarding. To be a nurse at Forest Park, I look for 3 things. I look for someone with excellent nursing skills, someone with excellent customer service skills, and someone with a great personality. Because we are a small hospital, I have small departments, and it's really important for a new employee to fit into our family. As a director of critical care, I think, honestly, the physicians don't want to have to use my departments. However, I think they find it a comfort that if they should need the emergency room or if they should need the intensive care unit, we're here, we're ready to take care of their patients, and we can take care of their patients just as well as anywhere else in the Metroplex can. When I first came to Forest Park, I was not familiar with bariatric procedures at all, and so I found it very interesting and very rewarding to learn new things. I think that unless you've worked at a hospital like Forest Park, you're gonna find that there's a lot to learn, a lot to do, and a lot of rewarding experiences to be had here.
Did you know that Forest Park Medical Center Pharmacy is equipped with a fax carousel? This system helps better manage inventory by automatically tracking drug inventories in near real time. This system also supports efficient packaging and labeling of medications within the pharmacy. Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Today at Forest Park Medical Center, with all the tragedies that have occurred in Cleburne, in Oklahoma City, in Granbury, we're hosting a Red Cross blood drive. The purpose of that blood drive is a way for us to give back to the community. Because although we provide excellent care within our 4 walls, we feel our obligation goes beyond into our community as well. So we want to give back to our community by providing a precious resource, that being blood, to those who may need it as a result of those tragedies.
Being able to have an event like this here at work is wonderful, and seeing all the employees wanting to volunteer and spending, 30 minutes of their time just to give blood, if it's going to help a baby, a mom, anybody, it's just a wonderful, wonderful thing to do.
Forest Park is trying to help the community and trying to give back to help others, and just being a part of this and the blood drive and in Forest Park is just really makes me feel really good.
We've done so many events when there's disasters happening around the world, with the trip to Haiti or going different places and giving back. Knowing that our organization supports so many good causes, it's just a good feeling. Come to work every day and know that you're helping.
At Forest Park Medical Center, we are a part of our community, and we like to give back every chance we have so that we are a part of services that are provided to all constituents in the North Texas area. So, whether it's giving blood or any other way we can be of service, we're here to help.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center, one of the top medical centers in all of the Dallas and Frisco area.
From the doctors to technology and, of course, the staff, Forest Park Medical Center is #1. And for more information on Forest Park Medical Center, you can head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.